Hello YouTube, this is video group 6 from Fulton psychology class, and we're going to be discussing the myth of abstinence and concerns to alcoholism and whether or not that is the only solution to stopping becoming an alcoholic. Thank you, and I hope you enjoy the video.
My name is Casey and I'm an alcoholic. It has completely taken over my life. I drown myself in alcohol every day, every night. I don't go to work anymore. I used to be really successful, but my life has just totally gone down the drain. My boyfriend and I became alcoholics together and he beats me. And I drink more because he beats me, make my pain go away, and I don't have a life anymore. Alcohol, that's my life.
Hi, my name is Raul and I'm an alcoholic.
Hi, Raul.
Through my learning at AA meetings, I've been taught that once an alcoholic, always an alcoholic. I know that this is based on the popular belief of the model of alcoholism.
Hey guys, my name is Andrew.
Hi.
And I'm an alcoholic.
Hi, Andrew.
That's true, Raul. The popular disease model views alcoholism as fatally progress disease caused by an allergy to alcohol.
Yes, I feel like sometimes I have no control over my body when it comes to drinking.
Hi guys, my name is Cassandra and I'm an alcoholic.
Hi, Cassandra.
Sometimes I feel like just a little bit of liquor will cause me to start binge drinking. Because of this, I have been taught that lifelong abstinence is acceptable treatment for alcoholics like us.
So I'm thinking of joining AA to help with my drinking problem. Can you tell me a little more about it?
Sure. It was actually a stockbroker and a surgeon that founded AA, otherwise known as Alcoholics Anonymous. Their names were Bill Wilson and Bob Smith. AA was founded in Arcon, Ohio in 1935.
Yeah, I've heard that AA is one of the largest organizations for treating alcoholics, with over 2 million members in the world.
AA's program is famous for its 12 steps that encourages members to admit they're powerless over alcohol. AA claims a recovery rate as high as 85%, but studies have shown that drinkers who join AA are more likely to relapse than those who haven't received treatment.
Yeah, it's been stated that AA benefits people who are more spiritual than the vast majority of alcoholics.
Well, this is good information. Can you tell me anything else?
Yeah, of course. AA actually has established this notion that alcoholism is a progressive and incurable disease. This notion that abstinence is a necessary treatment goal for all alcoholics.
In fact, the NIAAA, or National Institute of Alcohol Abuse and Alcoholism, revealed that 36% of respondents who were alcoholics at least a year before the survey were fully recovered.
Interestingly enough, 17.7% of one-time alcoholics could drink in moderation without abusing alcohol. This challenging the popular belief that once an alcoholic, always an alcoholic.
Wow, that isn't very strong evidence. Is there any other research about drinking alcohol in moderation?
All of this evidence for drinking in moderation caused a lot of issues among mental health professionals and researchers who had the idea that not setting abstinence as a treatment goal was tantamount to medical blasphemy.
But this was nothing compared to the criticism of Mark and Linda Sobel's reports created. They found that participants that trained in drinking in moderation consumed less alcohol and had fewer adjustment problems than did those treated with abstinence.
Yeah, the Sobel's research was based on the behavioral viewpoint and the belief that alcohol can be like other behaviors. In fact, alcohol use can be modified and, in some cases, brought under self-control. This is an option short of total abstinence.
So I don't have to follow everything like the 12 method step from the AA to solve my alcoholism. Wow, that is good information.
So, what are the other programs I could follow to overcome alcoholism?
Over the years, scientific controversy around controlled drinking ebbed following the craziness of the 1970s and 1980s, but never disappeared. Since then, researchers amassed considerable evidence for the effectiveness of behavior self-control training, known as BSCT.
Also, BSCT programs show in studies that moderate drinking could be a treatment goal. In BSCT programs, therapists train people who drink excessively to monitor their drinking, set appropriate limits for their alcohol consumption, control their rate of drinking, and finally to reinforce their progress.
Some of the other self-control programs emphasize teaching coping skills in situations in which drinkers had used alcohol as a coping mechanism, and preventing relapse by teaching drinkers to tolerate negative emotions. It has been shown that these programs are at least as effective as the 12-step programs, such as AAAs.
I really like the sound of BSCT. Thanks for the information. So, I really like the BSCT program. Are there any other programs?
The relapse prevention program runs counter to the notion of one drink, one drunk, by planning for the possibility that people may slip up and return to drinking.
The basis of these programs is that a relapse should not be a relapse. To prevent relapse, the trick is for patients to avoid situations in which they might be tempted to drink.
Moreover, they learn to understand that if they consume a single drink, it doesn't mean they are doomed to continue heavy drinking.
RP, or relapse prevention programs, teach people to think of a lapse as an opportunity to learn to cope with urges more effectively rather than to thinking, oh, I've blown it and I can't recover from it. A large body of research demonstrates that the RP programs reduce the rates of alcohol relapse.
I really like the idea of being able to mess up, but still be able to continue with my treatment of alcoholism. So, we've spoken about what programs are, but I would like to know what kind of treatments these programs incorporate.
Like gloves and shoes, one size, or in this case, one treatment doesn't fit all. Fortunately, a wide range of treatment options is available to alcoholics, including medication, psychotherapy, and support groups.
But the goal of abstinence versus controlled drinking may need to be tailored to individual patients.
Research suggests most people will probably be better served by a treatment program with the goal of abstinence. Yet, even if controlled drinking isn't for all alcohol abusers, it probably works for some.
The Institute of Medicine endorsed moderation as a treatment goal for some people with drinking problems.
I feel like there is hope for me in my journey to overcome alcohol because there are many options out there that will help me.
Drinking is a problem that affects almost everybody. Alcohol is a drug and it has a high rate of dependency. So abuse is very easy. The first method that was developed to combat alcohol abuse was Alcoholics Anonymous. And this program has been very successful for a large number of people, especially people who are deeply spiritual. AA has established the notion that alcoholism is a progressive and incurable disease, but this is not necessarily true. There is a notion that abstinence is a necessary treatment goal for all alcoholics. This has been shown to not be true for everyone. Other programs advocate drinking in moderation, such as the BSCT or relapse program. Relapse programs are so good in planning for the slip-up and teaching coping skills. So the key is for alcoholics to avoid situations in which they might be tempted to drink. There are a variety of therapies for alcoholics. Controlled drinking is worth trying for patients who failed repeatedly to achieve abstinence in programs with this goal. But the most important concept to remember is that there is hope for overcoming this dependency and addiction, and with help, we will overcome. Thank you for watching this video and hope you've enjoyed it.